Hello, everyone. My name is Audrey. I'm currently a medical student here in the Philippines. So, for this series, I took the liberty to ask some of my colleagues and friends to answer some of the questions to help aspiring physical therapy students. Now, to talk more about the DPT path via an agency, so let's welcome Kristan Rosario, a licensed physical therapist in the US and in the Philippines. So, Tan, thank you so much for finding the time to do this. I know you have been very busy for the holiday.
Yes. I'm glad to be here. I really enjoy these kinds of things so that to help, of course, raise awareness for physical therapy and to help others who plan to go through the same route. Because I'll be honest, there are lots of people who are kind of confused right after passing the board exam where to go. So maybe this will help shed some light on things.
Yes, actually, I have been confused before, so that's why that's why I made this platform just to educate the people, ba. Okay, so would you like to introduce yourself and ultimately how did you decide to go into physical therapy as the career you want to pursue?
Okay. So, hi guys. My name is Kristan Jason Rosario. I'm a physical therapist from the Philippines. I'm a PTRP. I'm also licensed in New York, so RPT in New York, and I'm currently taking my doctorate degree for physical therapy. So, how did I end up becoming a physical therapist, or why did I end up choosing this course? Well, of course, when we start off in grade school, we all had this dream, what we wanted to go through, and I felt that doctor is a nice ring, but I didn't feel like I wanted to spend like that much time because if you look at it, there's 4 to 5 years of pre-med and then 4 years of med, and then there's residency, specialization. I didn't think I'd had the what do you call this? I didn't think I had the fortitude to go through the entire process.
Yeah.
So I went with what would be an interesting course, and then I thought, physical therapy. And since my mother, who has some what do you call it? She has some pains. Usually, she would visit a physical therapy clinic. I ended up going, and I realized, I would like to go through this. I'd be willing to treat people in this kind of manner. So I went with physical therapy, and I fell in love with it. So that's how I am. I graduated physical therapy here from Bellas College, and yeah, that's pretty much it. Okay.
Okay. So what are the 3 things that excite you about being a physical therapist? So why do you love what you're doing right now?
Okay. So physical therapists can go through different routes, different specializations. Now, many people think that when you say physical therapy, it's merely being a masseuse or to manipulate the body, but it's more than that because there are different fields of specialty for physical therapy. There are people who specialize in pain. So literally, there are workshops, there are seminars for people who can literally erase pain magically. So apologize for the explosion there. Okay. So, my dog too. So, work from home, diba? So, specialties. So, there's physical therapists who are also ortho inclined. There are physical therapists who are neuro inclined. So, with that alone, you have many different routes for you to go out. It's not just simply I go out, I'm a therapist, I'll massage. That's not the thing. And the other magical thing about physical therapy is that you can really see the results of your patients because physical therapist is not inclined to use medicine. They have to study medicine. They have to study pharmacology. Don't get me wrong. I'm not saying it's not important, but in our line of profession, we have to treat patients based on their limitations, functional abilities that they have, and bring them to improve their quality of life. Okay? Quality of life, meaning how they are doing after, let's say, surgery. So in the surgery, so of course, when you say, I'm not really saying it into 1 to 3 anymore, but I'm just trying to say it as a whole. But when you see it, our form of access is not first response. When we say first response, that's definitely emergency, ER, surgery. And then when we say secondary, tertiary care, that's where we come in. Now, with that, once the fight in the surgery is over, the patient is sent to the room. But is the patient left alone in that hospital bed expected to just be okay? No. That's why there is such a thing as inpatient and outpatient physical therapy. Now with that, the fight transfers to the next group. We have nurses, we have OTs, we have speech pathologists, we have PTs. And PTs come in to ensure that the patient can get back to normal function, because it is very possible that after prolonged stay in the hospital, they may develop weakness, they may develop, I'll use simpler terms, weakness, they may develop tired, fatigue in a sense. And we are trying to avoid that, so that as soon as they are fully healed from maybe their incision, from maybe the cut, or whatever immobilization that occurred, they can return back to normal function as soon as possible. Such as patients who don't really have that much of a problem should be walking by day 1, day 2, depending on the type of surgery, in order to return them to close to function. Because if you think about it, once they're discharged, do you want them discharged in a wheelchair? And then once they're in a wheelchair, they might get demotivated. So that's another psychological aspect there. So with that, if you think about it, there are so much things that a physical therapist can do, not just as massaging, not just in sports. I'm not saying sports is bad. There are specialties in sports, and they are well paid. They are highly paid individuals. There's sports, there's coaches that are physical therapists inclined. There are outpatient, inpatient, specialties such as neuro, ortho, pedia, geria. There's so much. So it's not just a simple course that anybody can just go into, but it's a course that people have to take seriously if they want to get into it.
That's very true. Yeah, that's very inspiring, Tan. So actually, PTs, we're into skilled intervention.
Yes, very, very much so.
Yeah, so I know that, ever since we were in college, you were really one of those people that I look up to, actually, because of your rigid study routine, of course. you always do the best that you can do day by day, so that's why.
Oh my God. Memories from college, oh God.
Okay, so you took the NPTE before the TDPT, right? Am I right?
Oh yeah, because you're required to have an NPT prior to DPT.
Okay, so what was your typical study routine for the NPTE board exam? So what was the timeline, and eventually how did you get into the agency part of the DPT?
So here's the thing. After I passed the locals, the Philippine Physical Therapy Licensure Examination, that's when I actually didn't start practicing immediately, because I was still looking into going to agencies, and I'm not really that well off. So to be honest, I'm not really that well off for me to just go into a new endeavor and just have money to show for it. So I had to work for a while in a different route. So I didn't want to go through BPO. I'm not saying that doing a BPO is bad. It earns well, and if you can manage your time wisely, it can be good for you. But that's a story for another time. The idea there is I had to work in order to get the money to sustain myself as I'm pursuing the NPTE. And then I realized that the amount that I would have to spend to go through the NPTE, plus it is extremely confusing to do on your own with nobody to guide you. That's where I came to the decision to go to an agency. And that is Grandison Management. That's the agency that I currently signed up with. So with that, the agency covered my NPTE. So that's not an issue. I didn't have to worry about money anymore. So all my focus was into passing the practice exams, getting endorsed to take the exam, and then to actually pass the NPTE itself. So when we talk about my study routine, it's not simply studying. I had to couple it with work, because at that time, after my first job, I was invited to become a lecturer and coordinator and advisor for one of the local review centers here, Gold Rank Review Center. So being working individual at the same time as student, I had to juggle my time. So what happened was my office hours ended up becoming still 8 hours of a day, becoming from, let's say, around 12 to 8 p.m. or 11 to 7 p.m. basically. Because in the mornings of those days, I had to attend class. I had to attend review. And in that review, I had to pay extreme attention to the topics, because I wouldn't have that much time compared to the others to reread those topics. If I don't pay attention at this exact moment, I will be behind. That was my mindset during review, because I did not have the luxury of time. So afterwards, let's say morning starts at 8, my class ended at 11 or so, and I went to work. And work was, I was lecturing, I was doing some stuff. So that 8 hours of the day was cut for that because I have to earn. And then at the evening, that's when I started studying again. So in that part of the study, I had to recall, check the topics that were discussed the day on the prior, meaning that same morning, those topics I will bring back to me in the evening, and I have to review that. The purpose of that is my mindset in studying is always repetition. Okay? At the start of studying, repetition is required for you to grasp the topic as much as possible. And once it's repeated enough, it becomes not really second nature, that's kind of excessive to say, but it becomes familiar enough for you to formulate your own responses. Take note, I do not study for the purpose of memorization. I hate memorizing. And I think Audrey, I'm not sure if Audrey remembers that. I always said I hate memorizing things, diba? I always hate memorizing the things. I always thought about creating associations, especially people would say that, for example, anatomy. Anatomy is filled with memorization. I didn't think of it as a memorization. I thought of it as an association game. So if we talk about the muscle here, there are 3 muscles. Then you look at it into Netter. Netter is the atlas of the human body, which is the book, which is the pictures. Once you can visualize where they are, you can guess, or if not guess, you can formulate what are the most probable attachments to it. So if you say the biceps attached to the shoulder. So most likely you would say supraglenoid tubercle, diba?
Yeah.
Because it is attached to the shoulder area. That is how you study for me. That is the best way for you to study, because this is not limited to only the school. You have to bring it out with you as a professional. If you do not study with the purpose of applying these to your patients, then what good is the education you got it from, diba? So we're not here just to have a fancy title. We're here to treat patients in the future. So you have to take it seriously when you study. So that brings me to the point that if it comes to a topic that kailangan na jud siya i-memorize, for example, timelines, that's where I had to exert double effort in trying to, this time, memorize it. But of course, give it an association. If it is similar to another condition, okay, this condition is surgical healing, and this condition is normal wound healing in a sense. So incision versus natural wound. And you're trying to compare the healing process and the physical therapy manifestations management between those times. So you can look for a common time frame and a common difference, or common difference, common pa. A common managements that you can apply in each of those situations. And that association comes in. So if you think about it, my form of studying is not memorizing and knowing at that exact moment. It is sort of, I wouldn't say going along with the flow. It is more true to life, because when you're given a condition from your patient, it's not like you already know what it is, diba? Yeah. When you're given a condition with your patient, and then you see that there are symptoms that aren't consistent with the diagnosis, that's when you have to associate it with other conditions. And by doing that association, you are now essentially differential diagnosing. And by performing a differential diagnosis, you can either make or break a patient. You can really say, okay, this management will be effective to the patient. And if it's not, why is this so? So by that studying, that's how I ended up really looking into reading into the books, honestly. And then when you read into the books, you really have to check. Most people just skip the tables, but I tell you, the tables are actually the most important parts.
Yes.
Because they're actually, the tables may meaning, example, the timeline. This is acute phase, subacute phase, and this is the chronic stage of a patient. So this is acute, subacute, return to function, management. So by that table technically summarizes everything, and it's actually more important to read those than the actual text of the book. But the paragraph of the books, they help explain author's idea towards that topic. So reading that is just as vital, but it's not necessary for you to memorize. It's for you to be guided as you read the tables. If you read into the tables, it says here in the first chapter or in the first column that these are the management. Then if you don't really get as to why would this be the management, that's when you really have to read through the text. And when you read through the text, you will see that author's opinion towards that management. And then you realize, so ganun pala. Or ay, mao di, ay, So if you notice, these types of association patterns when you study, you can bring with to the real life rather than just leaving it to the book. And that's the problem I see with many students when they go through what do you call this? When they go through college, when they go through even in NPTE or review, because they just look at it as numbers. They just look at it as crude information that's just there for the exam. But if you look at it in a wider aspect, you look at it as more than just an exam, but your life in general, you would have a deeper appreciation for these pieces of information. So with that, when my duty would end at like 8 p.m., that's when I would study, and I'd go straight until 12. And of course, when I'm talking about timeline, 8 p.m., of course, I would eat. Who doesn't eat? So from eating, let's say 9. From 9 p.m. to 12 midnight, that's my remaining time of reading. And then when I read, really until 12 midnight, even then. So even my college life dragged on into my work life, because even then I still didn't have the freedom to really enjoy. I have more freedom now, don't get me wrong. But at that time, it was really a grindy period for me. And it's something that you really have to devote yourself or put yourself into time to. Or others, mangay, like people who I reviewed with, they actually dropped out of their jobs because they saved siguro enough. But because they can't really deal with the pressure of having to review and study at the same time. So in a sense, they're kind of impressed at what I did. And me, I didn't see myself as impressed as to what I did. I felt like I just had to do it because I need money.
Yeah.
So, and then again, another vital part for reviewing or studying in general is that you also need good rest. So I might not be the best example for going to sleep at 12 and then waking up again at 8, but it is the life or the pattern that I had to go through. Although I read indoors, sleeping early helps the brain process better. But yeah, that was my basic study routine for for review. It's not so much as the routine, but the mindset in reviewing for me.
Okay, so how did you get your Doctor of Physical Therapy degree? So what are the advantages and the disadvantages?
Okay. So when we talk about the DPT degree, is that